Health and care have become a very popular issues, being reported extensively in media, but also in scientific community. This has many reasons, but is attributed to the change of health system, but also to more general acceptance in a population. And we have seen a rise of people and patients, trans women, who want to undergo the gender reassignment surgery, and this number is on the constant rise. So let's start a little bit about the definition. What is gender dysphoria? It basically describes a condition where the assigned sex at the time of birth is different to desired gender, and in our case we'll talk about trans women who have male genitalia but feel and want to be women. And our role as doctors, surgeons, and the entire medical treatment team is try to minimize this dysphoria and preferably heal it as much as possible. So with another words, my principal role as the surgeon is not necessarily to reconstruct a vagina or to feminize the face. Quality of life. A short introduction of myself. I'm a plastic surgeon since over 10 years. I've been practiced and then board certified in Switzerland and in Spain, and I've been director of a gender reassignment surgery program at the University Hospital of Zurich in Switzerland, which is the biggest hospital in the country. I've trained gender reassignment surgery in Thailand with Dr. Preacher in 2015. And I'm associate professor of plastic surgery at University of Zurich since 2018. I've been practicing now in Switzerland and also in Spain, in Madrid, since 2019. We have a lot of partners that we cooperate with, and we try to treat these patients together. So let me introduce you a little bit of vaginoplasty. It is a fairly complex reconstructive procedure, and the problem is that there are no really any standardized surgical procedures that can be applied as a gold standard. So you have a lot of different possibilities how to carry out this operation, and I've been practicing surgical techniques surgery. It's a gentleman you can see in the left image. He was director of plastic surgery unit at King Chulalongkorn University Hospital, which is the building here in the middle in Bangkok, in Thailand, and he has developed a vaginoplasty technique 30 years ago, and he has been modifying it ever since. And the main advantage of his technique is that it's only one surgery, and that has a lot of advantages in terms of cosmetics and functionality. I've been looking at the numbers of patients that I operated in last years, and we have decided to summarize and analyze the numbers between 2016 and 2019. It's the period in which I performed over 100 vaginoplasties. And let me give you some insights about the most interesting data that we analyzed. The median follow-up of our studies over a year. The median age of patient is 37 years. The average duration of the surgery is 4.5 hours, and this is with breast augmentation. Without the breast, we are like 30 minutes quicker.